Every year, on average, 36,000 people die from influenza and 200,000 people are hospitalized.
So this year, our flu season is on track to be a pretty typical one. We're seeing about the number of cases and severity and the strain types that we would expect to see. The one unique thing about this season is that we're seeing an increase in cases earlier in the season than we typically do. It's also coinciding with an increase in some other respiratory viruses. So it appears as though there may be a higher level of infection in the community. It's not all necessarily influenza though. So some common sense precautions to prevent transmission of the flu are to stay home from school or work when you're sick. We also recommend that you don't return to work or school until you have been without a fever for 24 hours. And that is no fever without being on medications that reduce fevers such as Tylenol. Some symptoms of the seasonal flu are fever, cough, runny nose, headaches, body aches. Occasionally, you will see gastrointestinal symptoms, nausea, vomiting. This is not very common, however.
The Center for Disease Control recommends an annual flu vaccine for everybody 6 months and older. There are definite benefits of getting a flu shot, including reductions in illnesses.
Vaccinations also prevent flu-related hospital and doctor visits. Some diseases being spread are different from what is in the vaccine.
One recent study showed that from 2010 to 2012, kids who got the flu shot had a 74% lower risk of being admitted to a pediatric intensive care unit during flu season. Another showed that getting the vaccine was associated with a 71% reduction in adult flu-related hospitalizations, 77% in people 50 and above.
Vaccinations are available at all hospitals and many pharmacies around the metro area for a fee. The American Red Cross gives vaccinations at set locations on a few different dates around the country, as well as the world, free of charge.